Welcome to my PSA video. This is Luisa Velasco. My number one goal in the MSOT program was to apply evidence-based research, which was my top priority because I wanted to learn how to confidently use evidence-based in my clinical decisions. So I knew that if I wanted to provide my clients the best care possible, I needed to stay current with up-to-date practices and not just rely with what I learned throughout the courses, more so dig deeper. So I started making it a habit during my coursework to research on the Kaiser University Library, to read pertaining journals, and also participate in seminars such as CEUs to be able to apply what I learned into my courses into real world case scenarios, and this also really helped me during my fieldwork experiences. I even practiced breaking down, what I was reading and applying it to the client's goal as it was available. My main goal was to stay in line with the AOTA Code of Ethics, especially with the principle of beneficence and competence, because it helped me approach each case with intention, with curiosity, and of course, being a confident clinician. Staying up to date with my research also aligns with the AOTA standards of practice in using evidence-based intervention. That also emphasizes the importance of clinical reasoning and is staying informed with current practices. So it also supports the ethical commitment of competence, which means staying curious and growing my knowledge to better serve my population. One of the main things that I did during the MSOT course and to be able to accomplish my goals was to maintain my personal well-being. So I prioritized myself first of all, my family, my faith, which is huge to me because I know that this can be overwhelming. So I started becoming more organized, creating to-do lists, schedules to be able to be organized better. My advocacy throughout the program as I was growing more and more confidently, stepping aside from my OTA role until now becoming an OTR, I became a better advocate on the importance of the profession, bringing awareness to my clients, to healthcare providers, meaning speaking interdisciplinary meetings if appropriate, and also collaborating with my CI on making sure that the clients had access to any adaptive equipment that they needed. For my ongoing growth, looking ahead, I'm continuing to assess my professional and personal growth to mentorship, which is very huge to me, reflecting on myself, what can I do better, and ways to keep myself better as a clinician and as a human being to better serve my clients. Now let's talk about leadership. So to me, leadership it's not about directing or delegating tasks. It's about how I want to be seen as a leader, being held accountable for things, showing initiative, and of course advocating for others who cannot. One thing that I really wanted to do during the MSOT program, especially during my fieldwork, is I learned how I want to be seen as a future leader in the OT career. So one of the things that I demonstrated during leadership during my MSOT course is in February of 2024, I wrote a letter to Senator Marco Rubio in asking him to expand the Telehealth Access Act to allow others who live in rural areas who didn't have access or the means of transportation to access therapy services to be able to continue to do so via telehealth. I believe that this is really important, especially for the patients that cannot be, that are not able and don't have the resources to access to skilled therapy services. One thing that I want to mention it's the resources that I used during the MSOT program. So the number one was being an active member of the AOTA, an active member of the Florida Board of Occupational Therapy, and as well as paid the MBCOT certification to be able to give those resources to entities that are advocating for the OT profession in all levels. One thing that I want to continue doing as an OT practitioner is continue to advocate for others who cannot, as far as policies to be able to expand and grant others the access to therapy services, and of course volunteer with any applicable OT organizations. So now let's talk about the NBCOT certification. So first of all, we have to graduate from an entry-level degree program accredited by ACOT. We have to complete the 24 hours required in the state of Florida for fieldwork. Then we have to pass the NBCOT certification, abide by the 9 principles, and once this examination has been passed, we have to then follow the steps regarding to each specific state. In my case, it's going to be Florida. So then NBCOT will provide the state of Florida a certification number. Then I have to apply through Florida Board of OT licensure by endorsement because I was already an OTA. And then I will obtain my after I have paid the fee and fill out all of the information, I will obtain a paper license. In this case, lately they have not been able to provide any paper licenses, so through the Florida Department of Health, I will be able to download my license. And I have to, of course, in the state of Florida, complete the medical error certificate, the CPR certificate, the laws and regulations, HIPAA course, OSHA, and any appropriate continuing education courses that would be applicable for the setting that I want to work. And of course, I have to undergo background check. To continue with the licensing, I will have to every 3 years renew my certification through NBCOT and the Florida OT Board. I hope this video was helpful. Thank you. Bye.